Hello, my name is Dr. Kenechukwu Chudy-Onwugaje at the Redus Center for Digestive Health, and I'm here to talk to you about a common but yet misunderstood condition, peptic ulcer disease. In Nigeria, many people suffer from peptic ulcer disease, and some people suffer from other conditions that they attribute to peptic ulcer disease. I'm here to talk to you about the symptoms, the causes, and how we can prevent peptic ulcer disease. Peptic ulcer disease refers to open sores that can develop in the lining of the stomach, the small intestine, and the esophagus. And this occurs when the protective layer of the intestines is damaged. When this happens, ulcers can develop, and acid in the stomach can cause this to further worsen. These ulcers occur when the protective layer of mucus in the stomach is damaged, and this allows gastric acid to go into the lining of the stomach and cause ulcers. The two main causes of peptic ulcer disease are H. pylori and the use of non-steroidal anti-inflammatory drugs, which are a class of painkillers. H. pylori, also known as Helicobacter pylori, refers to bacteria that can affect the lining of the stomach and lead to ulcers, while non-steroidal anti-inflammatory drugs and medications that include Feldene, ibuprofen, and while these can work well for pain, they damage the protective barrier in the stomach, leading to ulcer formation. The symptoms of peptic ulcer disease can vary, but some common symptoms include significant abdominal pain, nausea, vomiting, bloating, and in some cases, when it's left untreated, it can lead to bleeding, which can manifest as black stool, vomiting of bright red blood, or vomiting of coffee ground material. It can also lead to perforation, and in very severe cases can lead to progression to stomach cancer. To diagnose peptic ulcer disease, doctors often perform an endoscopy, which is a procedure where a thin, flexible camera is passed down the throat to go into the stomach and the intestines to look for signs of damage to the mucosa of the intestines. We can also perform some other tests as part of testing that includes testing for H. pylori, which, like we said, is a bacteria that can lead to ulcers. The good news is that peptic ulcer disease is treatable. Where the cause is H. pylori, we can prescribe antibiotics to help to eliminate the infection. When it's due to taking a high amount of non-steroidal anti-inflammatory drugs, stopping these medications can help. The treatment of peptic ulcer disease includes using a class of medications called proton pump inhibitors, and this can help to begin to promote healing of the ulcers in the intestines. For patients that have a more severe presentation, such as those who come in with bleeding, they might need an endoscopic procedure to go and try to address the source of bleeding in the intestines or the stomach. So how can you avoid developing peptic ulcer disease? If you have H. pylori, it's important that you have this treated. If you take a high amount of non-steroidal anti-inflammatory drugs for pain control, it's important that you reduce or stop this, or that you take these medications under the supervision of your physician, as the use of these medications can be harmful. With regards to H. pylori, the prevalence is very high in Nigeria, but practicing safe hygiene can also help, as H. pylori is typically spread through contaminated water and food. Additionally, smoking and excessive use of any alcoholic products can delay the healing of ulcers and can worsen symptoms. Peptic ulcer disease is a condition that is common in Nigeria, but with the right knowledge, it's important that we recognize symptoms if we have similar symptoms, and it's important that we avoid the things that can increase our risk for developing this, including the use of non-steroidal anti-inflammatory drugs. If you are experiencing symptoms or think you may be at risk, I encourage you to visit your healthcare provider.